kids in rural India are getting the wrong medicine even when healthcare providers in rural India know the right treatment for childhood diarrhea and pneumonia. They rarely prescribe them correctly, according to a new study. Medical practitioners typically fail to prescribe life-saving treatments, such as oral rehydration salts (ORS). Instead, they typically prescribe unnecessary antibiotics or other potentially harmful drugs, says Manoj Mohanan, a professor in Duke's Sanford School of Public Policy, and lead author of the study in JAMA Pediatrics. Diarrhea and pneumonia accounted for 24% of deaths among children 1 to 4 years old, totaling approximately 2 million deaths worldwide in 2011. Bihar, India, where the study was conducted, has an infant mortality rate of 55 per 1,000 live births, the highest in the country. We know from previous studies that providers in rural settings have little medical training and their knowledge of how to treat these two common and deadly ailments is low, Mohanan says. 80% in our study had no medical degree. But much of India's rural population receives care from such untrained providers, and very few studies have been able to rigorously measure the gap between what providers know and what they do in practice. The know-do gap study involved 340 healthcare providers. Researchers conducted vignette interviews with providers to assess how they would diagnose and treat a hypothetical case. Later, standardized patients, individuals who portrayed patients presenting the same symptoms as in the interviews, made unannounced visits. This strategy enabled researchers to measure the gap between what providers know and what they actually do, the know-do gap. Providers exhibited low levels of knowledge about both diarrhea and pneumonia during the interviews and performed even worse in practice. For example, for diarrhea, 72% of providers reported they would prescribe oral rehydration salts, a life-saving, low-cost, and readily available intervention, but only 17% actually did so. Those who did prescribe ORS also added other unnecessary or harmful drugs. In practice, none of the providers gave the correct treatment, only ORS, with or without zinc, and no other potentially harmful drugs. Instead, almost 72% of providers gave antibiotics or potentially harmful treatments without ORS. Extra antibiotics. Massive overprescription of antibiotics is a major contributor to rising antibiotic resistance worldwide, Mohanan says. Our ongoing studies aim to understand why providers who know they shouldn't be prescribing antibiotics for conditions like simple diarrhea continue to do so. Our ongoing studies aim to understand why providers who know they shouldn't be prescribing antibiotics for conditions like simple diarrhea continue to do so. It clearly is not demand from patients alone, which is a common explanation, since none of our standardized patients asked for antibiotics but almost all of them got them, he says. Providers with formal medical training still had large gaps between what they knew and did, but were significantly less likely to prescribe harmful medical treatments. Our results show that in order to reduce child mortality, we need new strategies to improve diagnosis and treatment of these key childhood illnesses, Mohanan says. Our evidence on the gap between knowledge and practice suggests that training alone will be insufficient. We need to understand what incentives caused providers to diverge from proper diagnoses and treatment. Mohanan Also holds appointments with the Duke Global Health Institute and the Department of Economics. His co-authors are from University College London, Johns Hopkins University, Stanford University School of Medicine, Yale School of Medicine, the Indian Institute of Public Health, and Sambodhi Research and Communications. The Bill and Melinda Gates Foundation funded the work as part of the Bihar Evaluation of Social, Franchising and Telemedicine BEST project. Source: Duke University. Republished from Futurity.org under Creative Commons License 4.0. Next, read Trump's lawyer calls for end of special counsel probe. The personal attorney for President Donald Trump, John Dowd, called on Deputy Attorney General Rod Rosenstein on Saturday, March 17, to shut down the investigation by special counsel Robert Mueller. "I pray that acting." Read more. 2 million Americans quit food stamps in Trump's first year. The number of Americans receiving food stamp benefits dropped to a 6-year low during President Donald Trump's first year in office, reflecting a healthy jobs market and an improving economy, according to an annual report. Read more. In a first, U.S. blames Russia for cyber attacks on energy grid. Washington, the Trump administration on Thursday blamed the Russian government for a campaign of cyber attacks stretching back at least 2 years that targeted the U.S. power grid, marking the first time the United States. Read more.